Okay, good morning, everybody. If you can hear me okay, if you wouldn't mind sending me a little message in chat, just so that I know that audio is coming through. Welcome to today's webinar. I'm Courtney Sand, a neuro resource facilitator with the Brain Injury Alliance of Iowa. I am also a licensed and board certified behavior analyst and a certified brain injury specialist trainer. Today, I'm going to be talking about something called learned helplessness and its relationship to caregiving. And the title of today's webinar is When Pain Feels Inescapable, Learned Helplessness in Caregiving. Today's webinar is being recorded and will be uploaded to our YouTube page within the next probably 24 to 48 hours. Please feel free to interact if you'd like using the chat box. If there's opportunities to comment or ask a question, please feel free to do so. We have a small group today, so that works really well if you want to interact. If not, that's okay. With that, let's go ahead and jump right in. First slide is our disclosure slide. So the development of this content was supported by contract 5883B I-06 from the Iowa Health and Human Services Brain Injury Services Program. The content of this presentation is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard in this presentation. All right. How many of you, and if you're not a caregiver, that's okay. You may be a person with brain injury, you may be a professional, or some combination of the three. If you're a caregiver, you don't have to answer. You can think to yourself, you can comment in the chat box if you like. How many have you felt helpless supporting your survivor if you are a caregiver? How many of you have watched your loved one try and try again, only to fail, and then eventually give up on the situation and themselves? Probably most, if not all of you, I imagine. Very common, very expected. If you have, this is an unfortunate and painful, but very normal and expected part of being a caregiver. How many of you have learned of or have heard of learned helplessness? And if you have, do you know what it is? You may have heard of the term, maybe in a psychology or abnormal psychology class. It's almost always talked about in like a psychology 101 class. So you may or may not have heard of it, or you may recognize the term, but you're not able to define it. So my hope is that today you will leave knowing what it is, how it affects caregivers, and then how you can navigate and overcome learned helplessness if this is something that you're dealing with in your daily life. So what is it? Let's talk about it. Let's define it. So we'll talk about a little bit of history, because research in the area of learned helplessness started with animals, actually. So we're just going to go ahead and start there. So in animals, learned helplessness occurs when an animal is repeatedly subjected to an aversive, be it anxiety-producing, scary, painful stimulus that it is not able to escape. Eventually, that animal will stop trying to avoid the aversive stimulus and behave as if helpless to change the situation. Even when opportunities to escape are presented to that animal, this learned helplessness response prevents the animal from any further action on the part of it to escape. So it essentially learns to give up. The discovery of learned helplessness was actually accidental, and it was discovered in 1967 by psychologists and professors Martin Seligman and Stephen F. Mayer, who were conducting research on animal behavior that involved delivering a series of electric shock to dogs. This is a widely known experiment in the field of kind of introduction to psychology. So you may have heard of this experiment before. The dogs in this experiment that could not control the shocks that were happening to them eventually showed signs of anxiety and depression. Conversely, the dogs that could control the shocks that were happening by pressing a lever to stop them did not show signs of anxiety and depression. And actually up here in the right-hand corner shows the box that was used in a portion of this experiment, where there's a divider down the middle. The floor on one side is electrified. It's not on the other. There's a low enough barrier to jump over. In follow-up research, the dogs that could not control the shocks in the first experiment did not try to avoid the shocks, despite the fact that they could have done so by simply jumping over a barrier. They had learned to become helpless, even in the face of an option. It's fascinating, but heartbreaking research. Years later, Seligman, and I hope I'm saying that right, conducted research that suggested that the dogs did not, in fact, learn helplessness. Rather, instead, they had not learned control. He also coined the term learned optimism, which is used to challenge negative thoughts and combat learned helplessness. So with learned helplessness, there are three kind of key defining features. And Seligman was the researcher that defined it as having these three key variables. The first one is becoming passive, submissive, accepting, allowing what happens to oneself without an active response or resistance in the face of trauma. Number two, difficulty learning that responses can control trauma. And three, an increase in stress levels. In humans, so when people experience a stressful experience over and over again, they come to believe that they are powerless over that and unable to control or change the situation for themselves. So they no longer try. They stop. Even when opportunities for relief or change become available, they have essentially learned that they are helpless. Learned helplessness is particularly common among people who have experienced issues like trauma. So if you have or love someone with a brain injury, you have experienced and are living in trauma. Also, specifically things like domestic violence or childhood neglect and abuse, situations where you feel powerless over what's happening to you. And then researchers have also found that learned helplessness doesn't always generalize to all settings and situations of a person's life. So somebody may feel helpless in a certain part of their life, but not other. So it doesn't mean that that's necessarily how you see yourself as a whole and all of the situations in your life. Learned helplessness, what are the symptoms? And so in talking about this today, it applies to the caregiver feeling this way themselves about what's happening in their life because of the brain injury, and also watching what's happening to your loved one, sort of living in the after of brain injury, and or the person with the brain injury experiencing these. Some of those symptoms look like feeling a lack of control over the outcomes of the situation. So low self-efficacy is what we call that. One's belief in themselves that you have any control or power over the things that are happening to you in your life. Failing to ask for help, having low self-esteem, decreased motivation, procrastination, passivity, lack of effort, lack of persistence or endurance, giving up easily, frequently making pessimistic predictions about the future, ruminating on bad experiences from the past, focusing primarily on the negatives of any given situation, ascribing a lack of success to a lack of ability. So if you don't win, if you're not successful in a situation, things don't turn out the way you want and hope, you attribute that, you personalize it to a lack of ability. It's somehow a character flaw. It's something that you did or didn't do. Ascribing success to factors beyond one's control, such as luck. So when something good happens, it doesn't have anything to do with what I did or how hard I tried. It was simply luck. Feelings of frustration, and then all or nothing thinking, very kind of catastrophic global thinking, like nothing I do matters. I always fail. Learned helplessness and a self-fulfilling prophecy. How are they connected? Again, another term that comes up generally in a Psych 101 class is the idea of a self-fulfilling prophecy. So how is this related to learned helplessness? Learned helplessness is very naturally tied to the development of a self-fulfilling prophecy. Essentially, when you accept powerlessness, you perpetuate those beliefs, right? That's what you believe. It's how you're seeing the world. You're perpetuating those beliefs. A self-fulfilling prophecy is an expectation or belief that can influence your behavior, thus causing the belief to come true. I can't find, I keep trying to, meet someone and fall in love and go on dates, and it's just not happening for me for whatever reason, over and over. It's not a good match. I never hear back from them. It must be something wrong with me. I'm going to stop trying. I'll never find anybody. No one will ever love me or accept me. I'm going to be single forever. So they stop trying. Stop reaching out and being social. Stop putting themselves in situations where they might meet someone, thus actually causing the belief to come true. The idea that every time you try, you fail, you stop trying. So you're actually guaranteeing that you will fail. The idea behind a self-fulfilling prophecy is actually called the Pygmalion effect. And it's that belief about what will happen that drives the action that makes the outcome ultimately come to pass, right? If you expect everything to go wrong, you then put less effort into changing things or take steps that could actually turn that situation around for yourself, which means that expecting the worst actually can bring out the worst. This is very much about the power of the mind. How is mental health connected to learned helplessness? If it's something that you're living or witnessing in a loved one, you likely will see some of these things if you haven't already. So things like increased feelings of stress and anxiety, increased feelings of depression, a link with post-traumatic stress disorder, or substance misuse and abuse. So those are all very common. Why does learned helplessness only affect some people? Not everybody develops learned helplessness in the face of situations, where they have repeated failures or make mistakes. Why is that? What makes those who experience it and those who don't different? One of the big variables is something called an explanatory style, which is a person's way of explaining an event to themselves. So people with a pessimistic explanatory style causes them to view negative events in their life as permanent. This will never change. I'm going to always be single. I'll never learn how to walk again. I'm never going to find a job that I love now that I've had a brain injury. Pervasive. It bleeds into a lot of areas, and personal. I talked a few minutes ago about, it must be something wrong with me, something I'm doing. I'm a failure. I'm not good at anything. It's you're attributing personal reasons to failure. Those people that see the world that way are more likely to experience learned helplessness, and that makes sense, right? On the other side of that, though, are people with an optimistic explanatory style. It doesn't mean that you're always happy or that you're always successful, or that you see everything in a positive way. But it causes them to view negative events in general as temporary, right? Seeing things as this is just a season. This is the season in my life. versus this is always how it's going to be. It's specific. It doesn't mean that I am a failure in all areas of my life. This particular one is just difficult for me right now. And the reasons are external versus there's something wrong with me. I'm flawed. I'm less than perfect. It's something that I am or I'm not doing. Those people that see the world as temporary, specific, and external are less likely to experience learned helplessness. So now that we've laid the foundation of the discovery of learned helplessness and what it means, what are the symptoms, what is its connection to caregiving? So in the face of situations where it feels as though they have no power to change things, like a brain injury, you can't go back in time and change the way that happened, change that it happened, change the outcome. There are a multitude of reasons why caregivers, in the face of such a situation, with the best of intentions, can inadvertently foster codependence. And this is just a common dynamic that you see in caregiving. And again, almost always born out of the best of intentions. And some of those reasons why this can manifest are listed here. So things like guilt, shame and embarrassment. You're anxious. You have low self-esteem as a caregiver. You want to avoid the pain of watching a loved one try and fail, so you do for them. It's easier and faster to do things for your loved one. It might take them a lot longer to get dressed, to eat, to bathe, to toilet themselves, you name it. So you just jump in and do for rather than do with and kind of come alongside the person. A need to stay connected, a need to be in control, a need to be needed, and to feel like you're relevant and have value, that you're indispensable to someone. A need to please, being overly helpful to avoid feeling helpless. Fear of rejection and abandonment, fear of judgment and criticism from others, that maybe friends and family, medical providers, if your loved one isn't making a lot of progress in rehab, well, why are you not making him do his exercises at home? Why has he not made more progress? So that's somehow tied to your worth, your score, your value as a caregiver. Fear of conflict, fear of failure. So these are all very, very common ways to feel as humans, but also especially as caregivers. And then that's going to affect how you see the world, how you behave in the world, and how you interact with your person with brain injury. As a caregiver, and I mentioned this at the onset of this PowerPoint, you can witness your loved one's experience of learned helplessness. So you can see that it's happening to them and experience your own sort of journey of learned helplessness. Learned helplessness can cause dependency on others, or learned helplessness can develop as a result of being overly dependent on others. So it's kind of that chicken or the egg. It can go either way. What are some examples? And feel free to drop an example in the chat box if you can think of one. Your loved one has been battling addiction, post-brain injury. Despite participation in inpatient rehab and AA meetings, he or she continues to relapse. So you might see your loved one battling learned helplessness, and then they just give up and go, what does it matter? This addiction is bigger than me. I have no control over whether or not I'm sober. It's out of my hands. You might be witnessing that, and you might be experiencing it as well, and thinking it's something that I should be doing more as a caregiver. If he or she takes a drink, somehow that's related to something I've done or not done, right? You're attaching this sort of personal, you're attributing personal cause. Your loved one has been trying so hard in physical therapy to learn how to walk again. The rehab process is going much slower than he or she would like. So why try? I'll just sit in this wheelchair for the rest of my life. I'm tired of trying to be the person I was before my brain injury. It is too physically painful. It is too emotionally painful. Your loved one has been struggling to keep a job after his or her brain injury, despite having accommodations in place, just not able to go back to the things that he or she loved and was good at. I'm trying, but it's not working. I don't think I can find anything that I'll be able to do. I'm a failure. This brain injury has ruined my life. Your loved one has been attending monthly support groups and has been struggling to connect with other attendees and make friends due to his or her aphasia or ability to verbally communicate with the people around them. These are all very common. These are not wrong ways to feel. They just are. But this is how kind of learned helplessness is born, right? Especially if you have that pessimistic explanatory style and the way of looking at the world. So you know what? I go to these stupid meetings. I try to connect. I can't get my words out. And when I do, nobody cares. I sound and look dumb. Nobody wants to be my friend. I'm not going to go anymore. Why go? So you can see how that sort of perpetuates, and then people feel like they have no control over these things in their life. And brain injury does that in a very big way. Can you think of any examples? Whether you keep your examples in your head or you share them in the chat box, I'm sure that if you haven't experienced it in your own life, you've witnessed it in the lives of other people, most definitely. And if you're a professional attending today, that you've worked with clients and persons served who you've witnessed this many times and tried to help folks navigate this. So now that we know what it is, what it looks like, how is it tied to caregiving? Okay, so what can we do about it? Now that you know what it is, what can be done to manage it and overcome? The most common and effective treatment for learned helplessness is cognitive behavioral therapy, or CBT. The goal of CBT is to help individuals identify negative thought patterns that contribute to feelings of helplessness, and then replace those thoughts with more optimistic and rational, realistic ways of thinking. This process often involves carefully analyzing what you were thinking, actively challenging those ideas, and disputing negative thought patterns. You can work to overcome a pessimistic sort of explanatory style. So there's the optimism in all this. The first part is heavy on, of this presentation is heavy on what learned helplessness is. It's a heavy, it's a normal thing. It's a heavy, yucky way of feeling. But the second part should be more optimistic, that there is hope, there is a way of navigating this and changing it. In therapy with CBT specifically, people can receive support and encouragement, explore the origins of learned helplessness, develop ways to decrease feelings of helplessness, identify negative thoughts that contribute to this way of thinking, identify behaviors that reinforce learned helplessness, replace thoughts and behaviors with more positive and beneficial ones, improve self-esteem, work through challenging emotions and events, may have to process through some trauma, address instances of abuse, neglect, and trauma, and set goals and tasks for themselves. As I was doing some research on learned helplessness, I saw the term emotional heavy lifting, and I really liked that. So, learned helplessness can become a much greater problem than the brain injury itself once that cycle is in place, because there's often then no bottom to the helplessness. So we need to, and it's easier said than done. All of these suggestions around how to manage it are definitely easier said than done. And they're in no way said in a dismissive way as though they're, just do this, just change your way of thinking, just implement the strategy and everything will change. It's a process. And all of these bulleted things are difficult to do. But we need to hold our loved ones able. I liked that so much. Hold your loved one able. Remember that setting appropriate Realistic limits and expectations around their abilities is a loving act. And that might go against how you feel. Your worth as a caregiver might be very much tied into how much I do for my loved one, when that can be a disservice and can foster codependency, right? And this is such a common thing with caregiving. Talk with medical providers, talk with a therapist about, given my loved one's abilities, their strengths and weaknesses post-brain injury, what are appropriate, realistic limits for their abilities as well as mine? What can they do on their own? When should I jump in? How should I jump in and help? Set small steps toward big goals. That is very, very difficult. Rehab is not a linear, neat process. And you often have to learn how to celebrate these seemingly small steps because the process can seem so painfully slow. Learn to look differently at the daily tasks done for your loved one. And again, you can work with a therapist, neurologist, whoever, on some of these things. Things like, can he or she do any aspect of this particular task by him or herself? Even if it's a struggle to watch them do it, even if it takes 3 times longer. If so, can I let him or her do that? Is there a way this task could be modified to allow him or her to do it for themselves? How can I change this task to make it easier? Are there accommodations and strategies that we can put into place? Can the physical therapist, the occupational therapist, the speech therapist, the cognitive therapist, can they help me brainstorm and put some things into place to allow my loved one to do some of this on their own? If allowed more time, would he or she be able to do this task? How does my tone of voice and my approach sound when I am asking this person to do something? How will I know when it's an appropriate time to jump in and offer help? And am I giving choices to him or her, or am I making the choices by myself? So just asking realistic questions, some difficult questions around what your loved one's day looks like and the tasks that fall kind of into their routine. And set appropriate, realistic limits, as I mentioned, not only for your loved one, but for yourself as well. Encourage independence when you can. There is just a crushing amount of choice making and independence that is taken away from somebody after a brain injury, where they have so much less control over their lives and the ability to make decisions. So, if it comes down to, they need to take a shower this many days a week, what time of day do you prefer? First thing in the morning, after breakfast, midday, before bed? How would you like that to look for you? So as much as you can, offer or allow for choice making and the ability or allowing that person to do as much as possible in a task or steps of a task that they can. Encourage tasks that increase self-confidence. So to get sort of the initiation and the ball rolling, get some momentum going, you might have to start with things that increase self-confidence. When working every night with our son on reading, he's in first grade, if we're doing sight words, for example, we'll start with the ones that he's mastered. And he flies through those really quick and it boosts his confidence. You can see it on his face. You can see it in how he's reading the cards. And then if we're going to target some newer, more difficult things, we'll usually just naturally plant that after we've gotten that momentum going. So if you can do that throughout the day and throughout different tasks in your loved one's life, it certainly helps. Use specific language if you need to articulate holding your loved one able, and connect those phrases to goals, tangible goals, if possible. It can be really easy to go, okay, I'm going to march into these situations with a different way of looking at what helping my person means. But then when you find yourself watching them struggle, fail, have setbacks, it's easy to just kind of fall back into old familiar routines. So if you need to have these as anchor statements, that can be a really helpful thing in the face of these situations where you might go, nah, I need to default back to my previous way of caregiving. So saying things like, I love and respect you too much to do the things that you are capable of doing for yourself. Not easy to say. I want you to make as much progress as possible in rehab. So that means stretching what you're able to do, even if it's uncomfortable for you and me. I know that your goal is to eventually live independently. So that means you have to try to do this for yourself. Again, these are really hard to say. They're very heavy, but getting used to saying them, rehearsing them, role-playing them, saying them when you're looking in the mirror. It might sound corny, but getting used to saying the words, hearing yourself saying the words, and then using them as anchor statements in situations that are particularly difficult can be really helpful. Seeking help from others. You don't have to figure everything out on your own, caregivers, right? Whether that is something you've imposed on yourself or somebody's doing that to you, you can't do everything. You don't know everything. You just can't. So seek help from others, from your psychological family. I love that term. So a family can be whatever your family looks like. It can be made up of friends, colleagues, support group members, church members, whatever. Seek help from other people, whether it's respite, you need a break, or I just need to vent, or can I process this part of my day with you? Am I doing what feels or what seems right? Or do I need to back off and, process things with people, talk to people? We have at the Brain Injury Alliance of Iowa on Facebook, we have a private Iowa Brain Injury Caregiver Support Group. And if you were to type that into your Facebook search bar, just Iowa Brain Injury Caregivers, it'll come up. And it's a private closed group, and there's about 150 people already in there. And we started it in 2020. And it is wonderful. It's a place where you can get normalization, validation, and empathy from people who get it. Seek help from others, fostering resilience, both in your loved one and yourself, as well as self-worth. How you view your self-worth and how it is or isn't tied to what you're doing for your loved one. Cultivate self-compassion. And this goes for yourself, as well as fostering it again in your loved one. So these all go both ways, right? Whether you're struggling with learned helplessness and or your loved one, these can all be strategies used by either party. So not beating yourself up, your loved one up, when you don't meet your own expectations. Accept that you made a mistake and learn from it. Move on and focus on what you can do differently next time. Have more of a solution-focused lens. Okay, what didn't work? What did? What can you do differently in the future? Be empowered with that. Gain knowledge about the situation you feel helpless about. Knowledge is power. At the Brain Injury Alliance of Iowa, we offer neuro resource facilitation as a service. One of the huge parts of that is providing individuals living with brain injury, whether they're a survivor or a caregiver, information on brain injury and what to expect. Normalize some of the things that you might see. Get knowledge, gain knowledge about this. And, arm yourself with information. You feel even just a little bit less helpless when you have information as you sort of move into a situation and try to navigate it. Use both and thinking. I love this. And this is a cornerstone of ambiguous loss as well. If you've heard of that topic, it's a kind of grief associated with brain injury. It's something that I'm very passionate about presenting on. One of the ways to navigate that kind of grief, as well as learned helplessness, is something called both and thinking. So here are some examples. It essentially comes down to being able to hold two truths at the same time, and two truths that don't align. So it can feel foreign, weird, icky, you plug in the word, to hold two opposing truths at the same time. is not necessarily our default. A lot of times we look at it like black and white. I have to it's either this or it's either that. But with both and thinking, you can tell yourself things like, I can both be a good caregiver and not have all the answers. Instead of, I am a good caregiver if I have all the answers. I can both be a good caregiver and not do everything for my loved one. It doesn't have to be, I'm only a good caregiver if I do everything for my loved one. I can both love him or her and allow him or her to fail. I can both be a good caregiver and set boundaries. Very powerful flip in a perspective, in the way of thinking and seeing the world, yourself and your loved one, is this both and thinking. Write them down if you need to. Really powerful stuff. In my own life, outside of, having this be what I do for my profession, have dealt with brain injury and neurological issues in multiple family members, and have had to sit and say some of these for myself. It's not an easy thing to do, but this in particular for me personally has been really healing, this way of thinking. So I hope that if you haven't heard of this before, that maybe a light bulb goes off and you kind of play around with, okay, how can I heal my thinking and incorporate some of this language? Practicing mindfulness is another way of overcoming learned helplessness. Try to be in the moment. So much easier said than done, where we're not obsessing about the past and worrying about the future, especially as caregivers, where you're just hyper vigilant all the time. You're always worrying about, is this going to be a good day? Is there funding? Are the services in place? Is he or she successful? Always worrying about what tomorrow will look like. It's not easy to be present. Exploring ways to calm yourself down and relax, so self-care kinds of things. Yoga, meditation, prayer, deep breathing, walking in nature, listening to music, whatever helps you relax. That's going to be a big part of this too, is knowing what your coping skills are. Being realistic. You can't change what's happening, right? You can't go back in time and change the brain injury from happening. You can't change how it happened, what happened, those deficits, things like that. You can, though. As far as deficits and weaknesses, you can grow and make new connections and learn new ways of doing things. But, my point is, you can't go back in time and prevent it from happening. So focus on the things that you do have control over and that you can do for yourself and your loved one. You can learn to work with your loved one's condition diagnosis and be the best caregiver you can be, even though you can't change it for them. And perspective is everything. If you haven't noticed, that's sort of woven into everything that we've talked about, whether it's learned helplessness or self-fulfilling prophecy, the way that we see the world, our explanatory style, all that is woven to our cognition, the way that we think, which is why cognitive behavioral therapy is so powerful in overcoming learned helplessness. So perspective is everything. Normalize mistakes. Accept that a natural part of learning and growing, although physically and emotionally painful at times, those setbacks and making mistakes, that's all part of learning and growing. Remember that success is not linear. Normalize that learned helplessness is an unfortunate but normal and expected part of caregiving. So if you feel that way, to not beat yourself up about it and make the situation even worse, but just going, okay, this sucks and it feels awful, but it is nice to know that there's a name for something, right? That you're feeling, to have a name, to have a label for how you feel, and to know that while your situation's unique, feeling learned helplessness is not. It's expected as a caregiver, and it's expected to witness in your person with a brain injury. and understand, like we've been talking about this second half, that there is hope, that there are ways of overcoming learned helplessness. It's not a sentence, like a death sentence, like this is how I've always seen the world. I won't see the world any different. That's just perpetuating that learned helplessness, right? I've always thought this way. I will always think this way. Even the best therapist is not going to be able to change that about me. Wrong. There is hope. You can absolutely learn how to think differently and see the world differently. And then having hope for the future. This is also a cornerstone in navigating ambiguous loss, that kind of grief that I mentioned earlier that is specific to brain injury. Having hope for the future, again, not an easy thing to do when you're in the face of pain and not having answers. It's easy to tell somebody to have hope for the future. But if you're not in a season of your life, remember, because seeing things as global is that pessimistic explanatory style. Look at it as a season. It's temporary, right? It does not have to mean forever. If you are not in a season right now where you have answers or any hope about the future at all, that is fine. Give yourself some grace and sort of start with curiosity about it. If anything, just be curious about the future. You don't have to have hope for it right now. Be patient with yourself and have that be a goal that you work on in small steps, but just start with having curiosity about it. And that's all that I have for today. My goal, again, as I mentioned, was to define what learned helplessness is. Talk about some of the history. How was it discovered? What does it look like? How is it related to caregiving, specifically with brain injury? And then what can we do about it? So I hope that you've learned what it is. You've maybe walked away with some tools, maybe some hope, thinking that, gosh, my loved one is really struggling with this, or I am really struggling with this. What can be done? A lot can. And I hope that if anything, you walk away knowing that your experience is expected and normal, and that there is hope for the future and ways of overcoming this, the way of thinking of learned helplessness. So thank you to those of you who took time out of your day to join me. If you have any questions or comments, you can use the chat box, or feel free to reach out if you want more information or if you have any questions. Again, thank you for being here and enjoy the rest of your day. Thanks so much, everybody.